Hello, warmest greetings to everybody in Stuttgart, Brussels, Europe, and the rest of the world, and internationally. I am sending you warm greetings from the cradle of anthroposophic medicine here in Arlesheim, Switzerland, near Basel. This is the Klinik Arlesheim in 2020 that has been founded 99 years ago. And it was Rudolf Steiner, an Austrian philosopher, scientist, social reformer, who founded Anthroposophy, that provides an extension at looking at the human being apart from the physical, what we meet physically. And then it was Ita Wegmann, a Dutch physician gynecologist, who actually founded Anthroposophy together with Rudolf Steiner and was also the founder of the first anthroposophic hospital here in Arlesheim. And they both wrote a book together, The Fundamentals of Therapy, where they actually give expression to and elaborate on how they want to extend current reductionist medicine. And it's actually the first, I could say, definition of integrative medicine they give in their book. And I just read it to you briefly. There is no question of opposition to the medicine that works with the recognized scientific methods of today. The latter in its principles is fully recognized by us. And we hold that what we have to give should be used in medical practice by those alone who are in the position of fully qualified doctors in accordance with these recognized principles. We add further knowledge whose discoveries are made by different methods. And these methods are described in the book. And this is the first Klinik Arlesheim, a very nice place to look after 8 to 10 patients. We could say the first integrative hospital in Europe, at least, 1921. And right from the beginning of this hospital, when Ita Wegmann founded it, it was integrative, interprofessional, including nutrition, rhythmical massage, baths, internal, external applications, art therapy, and eurythmy therapy, which is a specially developed movement therapy in anthroposophic medicine. And right from the beginning also, there was an emphasis on development of cancer treatment with special focus on mistletoe therapy. And if we look at the challenge of treating cancer, which has been talked about by my pre-speakers, with the previous speakers, so clearly, we could say that tumor-directed therapies like surgery, chemotherapy, radiotherapy, precision medicine nowadays do not always lead to cure cancer, and they cause side effects. And the big question that's posed by integrative medicine and anthroposophic medicine, how in addition to these therapies, the forces of disintegration, which are associated with all tumor growth, this can be shown biologically in great detail, can be reintegrated into the organism as a whole in order that we achieve a sustainable cure, or at least a relief of symptoms. And now we can ask, what constitutes the organism as a whole? And in anthroposophic medicine, we look at the patient in 4 dimensions that play a role in creating and in designing our therapies. So first of all, what we all do also in mainstream medicine, we look at the physical level. You look exactly what type of tumor is it, what is the extent of the tumor disease, the staging has been done, and then one has to look what tumor-directed therapies need to be done. But then there is another level that cannot be shown in X-ray, but that's experienced by the patient, which has to do with vitality. with the regenerative potential, with am I refreshed in the morning or am I fatigued? Do I feel cold? Do I have appetite? Can I keep my weight? The whole vegetative state that has also to do with day-night rhythm, sleeping quality, and how strong we are during the day. So this vitality level is very important. And then as we move further to the more conscious side of the patient, we have the whole emotional level that faces great challenges with every cancer diagnosis. There is fear, depression, but also a lot of courage and hope. And then the whole question of pain that has to do with the soul and the body at the same time. And then on this conscious level, there is another level, which we would say has to do with the I or the ego, that can actually also direct emotions, can control emotions, and can have, even though there is fear or depression, can look at biographic goals, can look for the meaning of the disease, shows a kind of what we call scientifically self-regulation, which is the ability to adapt to circumstances without losing sight of one's own life goals. And also the whole question growing inwardly with the disease, which is termed post-traumatic growth, has to do with this, and also spirituality. And so in anthroposophic medicine, we try to address these 4 levels of the human being by doing tumor-directed therapies whenever this makes sense, but then try to enhance vitality by applying mistletoe therapy that works, that can ameliorate cancer fatigue and actually makes the patient feel a lot stronger than he would normally be, helps him to tolerate chemotherapies a lot better. And then also external applications and many other therapies. And then the soul can especially be addressed with art therapy, with music therapy, painting. I will show pictures to you in a minute. And then we have the individual dimension, which is addressed by psycho-oncology, but also spiritual care and patient education. Cancer patients want to learn a lot about their disease, but also about the world, about spiritual understanding, about biography question. So they are very eager to learn. And now what we can see that in a hospital in Berlin, the Gemeinschaftskrankenhaus Havelhöhe, a study has been done with breast cancer patients who had to undergo an operation in the breast cancer center, which they hold. And all they did was to address the I, to address the ego by doing 1 or 2 consultations with life review and addressing biographic questions. And what you find in this study is that those patients who underwent chemotherapy after operation, they had a significantly less fatigue after 6 months compared to those who did not have this life review before entering chemotherapy. So this underscores the importance for physical outcomes in addressing the I. And then if you want to inform yourself on the scientific background of mistletoe therapy, we have this website, which is completely in English as well. And we can see that mistletoe therapy can help, can ameliorate, can improve survival, can ameliorate fatigue, and various other things. And this has been extensive research has been done on this. And then we have the vademecum anthroposophic remedies, where all the remedies we hold that can help enhance, reduce pain or increase vitality. And we have the vademecum on external applications in anthroposophic nursing, where you find exact descriptions how to do compresses and everything. So in these hospitals, in our hospitals, nurses do embrocations to the feet, to the back, with oils of lavender or rosemary. And then rhythmical massage is a specific method of applying rhythm and harmonizing the body. And then we'd have oil dispersion baths that can enhance the warmth organism in a specific way. And then eurythmy therapy, specific movement therapy that harmonizes organ functions and helps a lot in cancer patients. It's one of the most loved therapy by many of them. And then we have the music therapy, actively performed actively or receptive in the palliative care setting, but in any other condition, it helps with breathing and with anxiety and many other things. Clay modeling can help to enhance the formative forces, and painting therapy is a widely used therapy addressing the soul in a very specific way through colors. And there you can see the development of a patient from the first picture, which shows a lot of darkness and actually shows how she works with the cancer, and then how that goes to a form with light and darkness separated and a living being in between. And to finally, I would like to put emphasis that all these therapies have an over-additive effect if you combine them, and you can achieve good results even in conditions where conventional medicine has little to offer. Just like cancer fatigue, which is a problem of day-night rhythm. And mainly these patients are offered standard aerobic treatment or meditation. But here in Havelhöhe in Berlin, a concept was developed for these patients, 10 units of group therapy for 3 hours, including eurythmy therapy, psychoeducational group and sleep education, and painting therapy. And what we see that after 6 months, even after 10 weeks and after 6 months, after this relatively short intervention, there is a significant improvement of fatigue and sleeping disorders compared to aerobic training alone. And it has not been published yet, but we even know that after 4 years, this effect can still be shown. So the effects are very sustainable if they include the active participation of the patient in these therapies. So summarizing what we have talked about, we can say that anthroposophic medicine has an inherent integrative approach on scientific conventional medicine. 4 dimensions of the human being are being addressed with each therapeutic method with varying focal point. And anthroposophic medicine and oncology aims for mobilizing the salutogenetic potential of the organism of the patient. For example, by re-educating the immune system through mistletoe therapy, supported by external applications and all the other therapies we have talked about. To achieve, to stop the pathologic growth acceleration and achieve sustainable responses, together with the other conventional treatments. Today, and this Thomas Breitkreuz will talk about, and Bärbel Mielich has done as well, a close collaboration within the field of integrative oncology, where anthroposophic medicine can give important contributions, is an important part of current efforts within anthroposophic medicine. I thank you for your attention.